Do you ever find yourself easily distracted or unable to complete a task at hand, whether it be a homework assignment or a work task or something minute? You soon begin to realize that hours have passed and you haven't completed anything at all. And sometimes it's hard to get back on track and produce quality work or produce work at all. All of this could be due to attention deficit hyperactivity disorder. According to the National Institute of Mental Health, there are 3 subtypes of ADHD. One is predominantly hyperactive impulsive, which means that a person can be very impatient. They show emotions without restraint. They act without regards to consequences. They have difficulty doing tasks. They talk nonstop, or they just have trouble sitting still during homework time or dinner time. The second is predominantly inattentive, meaning they have trouble focusing on completing one task. They may have selective hearing, or they may have struggles in following instructions, or they could become easily bored if it's not something that they have interested or enjoy. And the third subtype of ADHD is just the combination of both hyperactive impulsiveness and inattentiveness. So, what exactly are the causes of ADHD? Scientists have yet to discover an exact cause of ADHD. However, studies have shown that genes may be a cause of ADHD, just passed down through generation to generation. Also, environmental factors such as alcohol or drug use or dependency during conception or pregnancy may also be a cause for ADHD. Brain injuries may also be a cause for ADHD. However, children with brain injuries are less likely to have ADHD than children without brain injuries. And also, sugars or food additives may also be a cause for ADHD. So, how do you get diagnosed with ADHD, or what are the treatments for ADHD? For the diagnosis of ADHD, there is not a single test. However, when parents, take their children to doctors, the pediatricians more likely times than not refer the parents to a mental health specialist with experience in ADHD to assist with the evaluations. They look at the child's social behavior, social interaction, also their environmental factors, what type of household they live in, whether there is smoking or drug or alcohol use in the home. For adults to be diagnosed with ADHD, the diagnosis or the evaluation is a little more stringent just because they're already in adulthood. So mental health specialists have to go back into that specific adult's childhood behaviors or school environment, school interactions, and they use certain rating scales for adults to diagnose them with ADHD. As far as treatment for ADHD, there is no cure for ADHD. However, there are medications out there for symptom relievers. Most medications come in the form of stimulants. It seems unusual to use a stimulant to combat ADHD, which is the hyperactivity or inattentive impulsiveness. However, stimulants have the calming effect more likely on children, so it does the complete opposite. For the stimulants in 2007, the FDA required that makers of ADHD medications include a patient medication guide to inform the patients of the side effects or symptoms of taking these stimulants, such as heart or blood disease problems or even psychiatric problems. Living with ADHD can be difficult. As a parent who has a child with ADHD, I can attest to this. It's important to, have organization in your living environment. Have a place for everything, such as a place for toys, shoes, book bags, etc. It's also important to be consistent, have a routine, have a set breakfast and dinner time, have a set time for homework, and also a set location. Children with ADHD really need the consistency. That way they can get used to that and not have the desire to deviate from a set routine. And also outside activities such as involving either your child or yourself in sports, outdoor, nature. And furthermore, I mean, it's important to have rules and rewards. That way, especially children with ADHD, they can have an expectation of, if I follow these rules that are in place, then I will be rewarded. And it's also just good for them to, have a schedule and not be all over the place, because unfortunately with ADHD and not taking medication, that's more likely what's going to happen is this child or this adult is just going to be all over the place and not complete any task. Also, I mean, in a nutshell, just ADHD, can be detrimental to a healthy lifestyle or a functional lifestyle. It's just important to, get the treatment that's there. It can be in the form of medication or psychotherapy or the combination of both. Being inattentive and impulsiveness, it can suck sometimes. But the treatments are out there, as I mentioned earlier on, and although it is most commonly found in children, there are several adults who have it, but they may not know that they have it. And having ADHD doesn't make you abnormal or any less of a human. It's just you have a different way of thinking.